وقد يؤدي هذا السبب إلى اعوجاج في العمود الفقري وبالتالي آلام في الظهر وكذلك في الرقبة. الجراحة هي الحل الأمثل لكنه حل صعب للكثير منا. لكن بعيدا عن الجراحة هناك تقنية جديدة الأولى من نوعها في الشرق الأوسط تعتمد على موجات الصوت لعلاج أوجاع الظهر بعيدا عن الجراحة. نحن هنا في هذه العيادة في دبي مع الدكتور تود كيهل. هلو دكتور and welcome. وهو سيطلعنا أكثر عن هذه التقنية. Welcome دكتور.
أهلا بك دكتور. هل لك أن تطلعنا على هذه التقنية الجديدة؟
هذه هي الآلة التي نستخدمها في العلاج وتعتمد على معالجة العظمة الأولى وأعلى العمود الفقري. وعندما نقوم بتصحيح وضع هذه العظمة نقوم بتصحيح وضعية بقية العمود الفقري، لأنه عندما يكون هناك التواء في العمود الفقري يؤدي ذلك إلى عدم تعادل عظام الكتفين وعظام الورك، ويؤدي ذلك إلى انكماش العضلات، فينتج عنه عدم تساوي الساقين وتكون واحدة أطول من الأخرى.
إذن كيف تعمل هذه الآلة؟
تعمل هذه الآلة على منطقة ما تحت الأذن، ونكون مسبقا قد أخذنا أشعة ودرسنا وضعية المريض وحالته وما يحتاج إليه، فتقوم الآلة بإرسال موجات صوتية تقوم بإرسال ارتجاجات للمكان وتعدل وضعية العظمة معيدة إياها لوضعها الصحيح. هذا أحد المرضى كريغ موريس الذي عانى آلاما مبرحة في الظهر. قدم إلى العيادة على كرسي متحرك ويخضع لجلسات العلاج منذ عدة أشهر أظهر فيها تحسنا ملحوظا، إلى جانب أنه وزوجته ينتظران طفلا بعد أن قيل له أنه قد لا يتمكن من الإنجاب. الآن باستطاعة كريغ المشي والسباحة.
هل لنا الآن أن نرى كريغ يتلقى العلاج؟
في بداية العلاج نقوم بقياس طول الساقين كما شرحنا سابقا، واليوم نستطيع أن نرى أن ساقه اليسار أقصر من اليمين. ثم نرى إن كان هناك أي انتفاخ في محيط رقبته وكتفيه في مكان الأعصاب، ولديه بعض الانتفاخ اليوم، ما يعني أنه بحاجة إلى إعادة التوازن. ونقوم بضبط الآلة تبعا لحاجته. ونضع رأسه بالمكان الصحيح ونقوم بإرسال موجات الصوت وهي غير موجعة. نقوم بفحص رقبته التي اختفى منها الانتفاخ مباشرة. ثم يستلقي على بطنه لنفحص طول ساقيه التي يبدو أنها متساوية الطول بعد جلسة العلاج.
ما هو عدد الجلسات التي يحتاجها المريض وما هي الفترة الزمنية التقريبية للعلاج؟
يحتاج المريض عادة بين 10 إلى 15 كمعدل متوسط، ولكن بحسب الحالة وتحسن المريض يتم تقرير ذلك.
Thank you very much, doctor, for being with us today.
Thank you.
بالفعل مشاهدينا، تقنية واعدة قد تغني أولئك ممن يعانون آلاما في الظهر والرقبة من اللجوء إلى العمليات الجراحية، وأنا بدوري أتمنى الصحة والعافية للجميع.
Nature, time and patience. They are the three great physicians in this world. Hello and welcome all of you to yet another episode of Meet the Masters. Well, today the Medibis TV camera crew is at the premises of Blue Tree Clinics here in Dubai, and I am in conversation with Dr. Tod Cahill, and he's a chiropractic physician. Hello and welcome to the show, Doctor.
All right, it's a pleasure to have you.
Well, doctor, tell us something about yourself.
Well, I'm from the U.S. Originally was an engineer. Then I went back to school and got another degree in general biology, then a doctorate in chiropractic care.
Tell us something about the clinic as a whole.
The clinic is basically a non-invasive treatment clinic. So we specialize in chiropractic or adjustment of the spine. We have about 8 physiotherapists that work for us. We have an orthopedic department. We also have a dermatologist that works here as well.
So why the UAE? Why not US?
Well, that's a good story. But I was working in Atlanta and with the founder of the technique that I work with. And a patient came from the UAE, Dubai, to Atlanta. Was impressed with the work, and they were also investors, and they asked if I would come here and work in this Dubai. And that's how I got here. I worked at Healthcare City for several years as a medical director there and practicing physician. Then I moved over here about 2 years ago.
Now, chiropractic, when did it evolve? And we'd like to know about the history of the so-called treatment practice and so on.
Okay. So about 1895 it started. A guy named D.D. Palmer started it. His son actually was more famous. His name is B.J. Palmer, and he wrote many books about the spine and particularly the cervical spine. He concentrated in the very first bone called the atlas, and he adjusted that bone almost exclusively. At that time, 1910, when he started practicing, he used imaging, and then that imaging with mainly x-rays, he would get measurements off there and get a correction vector and then correct that atlas bone. Mm-hmm. And when that bone is corrected, it changes the whole spine.
Well, when you say chiropractic treatments, how does it work? And in fact, what sort of patients come here, and where is it applicable in patients?
Okay. Most of our patients are going to be patients of neck pain, back pain, headaches, maybe extremity pain, elbow, knee, like that. Those are the most common patients coming in, so 80–90% of the patients that come in from that. Traditionally, chiropractic was a little bit more hands-on. I've kind of gone another way where I've used modern technology. So I'm using a sound wave to adjust the spine and other instruments as well.
What are the core or prime instruments that are used, to be precise, the core instruments?
Okay, so one of the main devices I use here is behind you here, and that's called the Atlas Orthogonal Adjusting Instrument. So I'll just break that word down a little bit. Atlas is a nickname for the very first bone of the spine in the neck. It's also called cervical 1 or atlas. Orthogonal is kind of a math term, and it means 90 degrees. So we want the atlas to be flat or horizontal, and we want the rest of the head, the center of the head, and the rest of the spine to be 90 degrees. So that's what that orthogonal word is. And so that's one of the instruments, and I have several other instruments that I might adjust different bones other than that first bone.
And when you talk about this practice, what age groups come to you as patients, or when does the disease start, and what age groups?
Okay, so that's a good question. And as I've gotten into chiropractic, it was a little bit different. I used to see a lot of 40-year-olds, 50-year-olds, but now I see a lot of more younger people, and I think that's because of modern technology. They're growing up with iPads, and so they're in forward flexion or SMS messaging, always in forward flexion at now. So they have symptoms of neck pain or headaches, and oftentimes they might lose their primary curves in their spine, and we're able to correct those quite easily at that age. The earliest patient I've seen probably is 3 weeks of age. That was a baby that was crying all the time, had some swelling behind the neck. We were able to adjust that baby, and the baby was able to go on to a normal, healthy life. And then probably the oldest patient I've had was 95.
What are the precautions that one should take to avoid such diseases or breakage?
Okay, so that's probably half of my job. So that's a good question. The daily lifestyle that usually gets people in trouble. Maybe only 20% is trauma-induced, maybe a fall or a car accident or something like that. So obviously we have those patients as well. but mainly it's lifestyle. So part of my job is to teach ergonomics, and that starts with sleeping position and what they're sleeping on. We fit them for a pillow often so that they're staying in a neutral position. Then the next time is they're at the desk all the time, on the computer. So we try to teach ergonomics and that. And then to mitigate that daily lifestyle, we also teach an exercise routine and program. So we really want them, if they're at an office position, to stop every hour and a half or so, just do some quick range of motion exercises, and then go back to work. And companies have been happy to have me in to help me with their personnel with this. They don't want their personnel out sick or in having surgeries or anything. So if we can teach them to stay a little bit healthier, that's a better thing. Be proactive than reactive.
When you talk about the treatment, I know it is different for different people, and with regard to the stability of the disease. Now the fact is that what I'd like to ask you is that the length of treatment for a particular disease, or you would have encountered so many patients, and the experience of yours is wide enough. So when you talk about the length of treatment, what's your take on that?
Well, I think, like you said, each patient is unique. So say an average teenager, they might come in, and I might see them maybe 3, 4, 5 times in a 3-month period. And then after that, I might just have a checkup every 3 or 4 months with them. Similar to the dentist, we don't want you to have your teeth rot out. We don't want the spine to get into trouble. So we rather have you come in for like a maintenance program. Now, somebody of different, more pathology, say osteoarthritis with degenerative disease, or protruding disc or disc bulge, they'll be a little bit more complicated. So their program is going to be a little bit more intense for the initial 3 months, and then we'll determine what they need to keep on maintenance, right? And I might incorporate physiotherapy for that. Other cases like scoliosis, they're a little bit more intense with the physiotherapy exercises that they'll do at home. And so they'll be on a little bit more maintenance program than the average young person.
And what are the cost implications when a patient comes to treat? Let's take an example of a patient who you would have treated with your experience. In terms of cost, and is it insurance covered? I
would say some insurance covered, not all insurance covered. Like all insurances, the more you pay for it, the better coverage you get. They're in the business, right? So they're not necessarily your friends to cover you, but say insurance like Bupa International or Psycho, we have direct billing with them, so all their costs are covered. Other people, I would say maybe 40 or 50% is the cash practice, then, and then we have a little bit discount for cash patients.
Well, you are in this business for the past how many years, doctor?
7.
7 years. Mm-hmm. Well, so during the past 7 years, you would have encountered so many patients with different problems. So if you could share your experience on any one such patient, without mentioning the name of the patient, that's fine. But, which is worth sharing, and viewers could, get a glimpse of the experience.
Okay. One of my first patients was a young girl of 7 years old. They had what the diagnosis converging strabismus, meaning that the eyes were coming in, pointing in, so she couldn't, when she's looking at you, you don't really think that she's looking at you. Okay. We were able to solve that case. That case was oftentimes a surgical consult as well, but we find that many of those cases come from lack of vascular blood network to the brainstem. The brainstem has the cranial nerves on that. The cranial nerves are what control everything from the head. Mm-hmm. And so that includes the eyes. Now, the patient's atlas, the very first bone. Okay, so I have a little prop here that will kind of help us. Visual is always better. So this is the very first bone called the atlas. This is the second one called the axis, or cervical 1 and 2. So the skull sits right here. There's a blood supply called the vertebral artery that comes up these little holes of the first 6 vertebrae. And when this is in misalignment, it can put pressure on that vessel. That vessel being reduced, which supplies the brainstem and the back part of the head, being reduced, it made the cranial nerve not respond so well. So when we were able to reposition this back, her eyesight corrected right away.
Well, doctor, where do you see the medical industry in the next 5 years in your department of practice?
Hopefully, and the way I see it going right now is more and more patients are involved in their care. So if they're prescribed a medication, they go home, immediately Google it and see what the side effects of that might be. And also they want to be more active in their care. So that's exactly what we want. We want to be more proactive. So we'd rather have somebody come in and get a checkup, keep their spine in good condition, than to come in 30 years later and have radiating pain down their arm from a condition that started earlier on. So I think the more proactive, the better. And I think patients are wanting less and less drugs to be on. So we offer an alternative to that to try to get your body to respond and be as healthy as possible. The body is a wonderful thing. If its nervous system is what we're actually adjusting, we might adjust bones, but we're affecting the nervous system and the vascular system as well. So if the nervous system is working as well as it possibly can, it can take care of anything. So God did design the body very well, and if it's capable of doing it if we give it the chance to do so.
If you look into the ratio of patients in US and the Middle East, what is your take on that in terms of the ratio of patients coming here?
You mean as far as gender?
Yes.
And gender? Okay. So I think all medical is dominated by the female. So the female might come in first, might bring their child first, but then push their husband in. So I would still say that I see about 65% women. Oftentimes it's usually the whole family that eventually comes into my office. So I might get mom first, then she might bring the child in for a checkup, then the husband will be pushed in, and then I'll treat the whole family as a whole.
How important is exercises, the physical movement of the body, important to a human being in this part of the world, especially in this part of the world?
Yeah. So there's challenges in each area, and this demographic there we get challenges because it's so hot during the year, a large part of the year. People don't go out and do exercise, and also don't go out in the sun. So we have a lot of low vitamin D levels in our chemistry that we check for the patient. So we often design a diet or try to get them to do at least 15 minutes 3 times a week outside as a walk. Now, most of my preventive care is exercises. So I have designed specific exercises. I have an exercise book for each patient. Now, I fix what I need for each patient, and I would have them do that. They don't take very long. It might seem like I might give you 5 or 6 exercises, but if they're only taking 2 or 3 minutes, really it doesn't add up to much. And so I'm trying to mitigate the daily lifestyle, and that's the majority of my job other than adjusting is to get education for the patients.
How long should one exercise? Let's say a working lady or a working man in let's say in the Middle East who has a Friday and Saturday off, or who is on duty with who's having an 8-hour duty, and then the rest of the time he's stuck in the traffic. So they make excuses. So, but nevertheless, what duration should someone exercise? Okay. To keep his body fit or something like that.
I think the studies have evolved in that, but really, it always goes back to hunter-gatherer years. What was naturally done as we were hunter-gatherers? Did we jog for 2 hours? No, we didn't do that. So we might have chased something or be chased by something, otherwise it was walking a lot. So the new studies show that more like running and then walking, running, then walking in a shorter time period is very helpful for the heart. And anything that's helpful for the heart is going to move blood around, and that's helpful for the whole body. So those things can be done in 20 or 30 minutes, right? And then modest, maybe body weight exercise as well. And maybe 3 times a week is a very good start.
Well, doctor, the machine behind me, which you had mentioned a few minutes back, we'd like to have more information on the practicality of the machine.
Okay. So it's called the Atlas Orthogonal Adjusting Instrument. And what it does is it sends a percussion wave to the edge of the very first bone. So on x-rays, we're going to do some very technical x-rays. And we're going to get motion this way, where this thing is sitting, and how it sits up and down. So we're going to be able to get a 3-dimensional view of this, taking 2-dimensional pictures at several pictures at one time. Okay? So we're going to get a correction vector. Say it's up and forward on you. Say 3 degrees and 2 degrees forward. We're going to put that vector into that instrument, and through a percussive wave, it's going to move this bone back down. As this bone moves back down, it goes top down all the way down the spine. So all the way down the spine until the pelvis there, it's going to make corrections as this moves back into place. Now that machine, you will not feel, you will just hear a sound. Since it's a percussive wave, you feel nothing. It just lays on top of your ear, underneath your ear there, and you'll hear a little sound, and that wave of energy has gently moved that bone back. So there is no feeling or pain or anything during the adjustment. Then retest the patient to see if that bone is back in its place through practical means, and if it is, then we'll move on with the patient.
Well, what sort of equipment is this, doctor?
This is called an activator. And it's unlike this, which is a percussive wave, this is a mechanical force. And this one moves very quickly, but not very far. So if I have a vertebrae that's rotated or a pelvis that sits high, I will set up on the vertebrae and just deliver the little quick thrust into that. That will allow the vertebrae to move back into position.
And what sort of equipment is this, doctor?
This is called an arthrostim. So again, this was going to supply a mechanical force. And
from here? Or?
From here.
Okay, from here.
Okay, so this it has different heads that come with it. So they slide off and on. And this one is particularly where I can have the spinous process, or part of the vertebrae sits in between it and it grabs onto the edges. At this particular adjusting head, then I'm just trying to put motion into the vertebrae. Oftentimes we might get a block of 5 or 6 vertebrae that are kind of stuck in their position. So we'll just do a light force on that. We can adjust the force back here. We'll do a light force on that to get that moving back into where the segments are moving separately away from each other instead of one block being stuck together.
Well, doctor, what sorts of innovations, developments, or the so-called R&D, the research and development, is taking place in the field of chiropractic treatments?
Okay. College that I graduated, they're probably one of the leaders in research and development. They just completed a study on the adjustment of the atlas bone, which we've been talking about today, that first bone, the most important bone of the spine. And when they researched the effects of blood pressure when that bone is adjusted, when it's moved back into position. And what they did find was that systolic pressure, there's the top number and the low number, systolic and diastolic. And the top number, they were able to change the blood pressure from 11 to up to 11 points, and the lower one down to 9 points down. So people that were maybe on the borderline of high blood pressure, moving the atlas bone back into place allowed for the system to self-correct and keep them maybe from medication or from excess medication.
How do you find time between your professional life and your personal life as a doctor, as a busy doctor?
Yeah, and that's a good question. A doctor needs to stay up on things. We have simple requirements of getting 30 continuous education hours. And oftentimes I do this in the US, do speak in October usually at a conference, but I do have to keep up on research. So we're trying to always get better. So keeping up with research, that takes time away from our practice and away from our family life. What I try to do is make my schedule as tight as I can. I never hardly ever take lunch. I usually come in at 9, work till 6:30. I don't take lunch. I see as many patients as I can during that time period. But I do leave at 6:30. And at that time, then I try to eliminate any work conflicts in my mind and go home and deal with my family.
And where do you see yourself in the next 5 years, coming 5 years?
I used to do a lot more research. I'm probably a little bit interested to do a little bit more of that. I had the opportunity to work for the founder of the Atlas Orthogonal program, Dr. Roy Sweat, and we did lots of research together, wrote 4 books together, and we did many research projects there. So I did some teaching as well. So I kind of like those things, and I feel, it kind of gives me relaxed time from seeing patients. So I'll probably develop a little bit more time for research, maybe a little bit less on my practice.
Well, doctor, we never spoke about the headaches, where people come with different types of headaches. Could you share your experience?
Okay. I will again use the problem.
Oh, yes.
All right. So we talked about the vertebral artery earlier that comes up through here. That one is often implicated in reduced pressure there that people get migraines. Migraine headaches are when there's not proper blood flow to certain parts of the brain. And when there isn't, the body has to react to that. So its adaptations might be to tell the vagus nerve to come and tell the heart to beat harder, or the autonomic system opening up the vessel. When it opens up the vessel, that's when the nerves get pressure on it. That is when the migraine is a problem. So if we can get the vertebral artery to flow as best as it possibly can, coming up through the neck and into the back of the brain, and the other arteries, like 2 other arteries that come up in the front, if we can have the best room and the best flow on that, we won't have the migraine headaches. 80% of headaches are cervicogenic headaches. So that's problems with the cervical or the neck, and that's influencing pain onto the brain. The second vertebrae, called C2 or axis, its pain distribution is around through here. So oftentimes it involves the second vertebrae having an influence on these cervicogenic headaches. Now, people might come and say to me, I was driving and I get headaches, or I have tension and I get headaches. That usually means that they have an underlying problem with the neck. And then the tension, which might bring the shoulders up or tighten the muscles here, puts a little bit more pressure on those components of the neck, and that creates a headache. But it's not the underlying problem. So that's what we want to try to do, is get the underlying problem fixed, get the neck in good shape, and reduce these headaches to 0 if we can.
I've heard some people complaining that if they don't eat on time, they get a headache. What is your take on that?
It's a little bit of physiology thing. So yes, if sugar levels are low, or maybe they drink so much caffeine and then they come off the caffeine and coffee. So some intake from food and drink do influence if you have some headaches as well. And that's more of a physiology thing. But it also would be a discussion that we would have in history. So I would understand what your diet is, and then so I can have the correct diagnosis for that as well.
What is your advice to people, in terms of leading a very healthy life?
Well, I think you can't neglect your spine. So I would like people to come in and get a checkup before they have symptoms. I think that's the best way to do things. Oftentimes I get it the other way. Now maybe they had a car accident 20 years ago, and so they didn't really get their spine dealt with, and now they have very much complications. So I prefer to see people early on, get things corrected, come up with a campaign for their lifestyle, to mitigate their lifestyle, maybe do ergonomics better. And so I prefer that we move healthcare more that way.
Thank you very much, doctor, for a wonderful time.
What causes aches and pains in our back, neck, legs, arms, head, and joints? What is the source of these problems that can become so detrimental to our quality of life? Why live with pain as so many of us do? Many of these problems can be associated with the imbalance of the spinal column. The spinal column is a tunnel of interlocking bones called vertebrae that protect the spinal cord. The spinal cord is an extension of the brain, together known as the central nervous system. There are spaces between each vertebra, allowing nerves, which are extensions of the spinal cord, to supply and connect every part of the human body. Therefore, it is the nervous system that regulates and affects all body functions. The nervous system can be likened to a major superhighway. Without problems, and all vehicles going the speed limit, travel is smooth and without accident. However, if there is a car crash, traffic slows down and even stops. The highway does not function as it was intended. When the spinal column is misaligned and out of balance, the nervous system is unable to function as it was intended. Many years of clinical research point to the fact that much of the problem associated with spinal misalignment and its consequences can be associated with the atlas vertebra, the top cervical bone in the neck. This one bone can affect the alignment of the entire spine. The spine is like a chain. When the first link is twisted and turned, each link down to the last turns, thereby disrupting the rest of the chain. Consider the atlas the first and therefore the most important link in that chain. The human body is balanced when the head is positioned in the center of the feet. When the atlas is misaligned, it causes the head to tilt. The spine then shifts to support the weight of the head, thereby creating biomechanical and postural stresses and strains. When the atlas bone is properly aligned, that is, in the orthogonal or neutral position, the rest of the spinal vertebra come into better alignment, allowing the body to heal itself. The delicate and complex connections of the nervous system allow communication between the systems of the body. An examination of the anatomy of the atlas vertebra reveals that it weighs a mere 2 ounces, and the human head weighs 9 to 17 pounds. Hence, the likeness to Atlas, the figure in Greek mythology who carried the world on his shoulders. The atlas is located directly under the head, connecting the head to the rest of the spine. The atlas supports the weight of the head most efficiently in the orthogonal or neutral position. Atlas orthogonal is an engineering term referring to the position of the atlas being 90 degrees to the head and neck. Trauma in one form or another is the primary cause of misalignment. When the atlas vertebra is subjected to stresses and strains, it may be pushed out of proper alignment. Trauma may include car accidents, no matter how minor and regardless of immediate symptoms, slips and falls, blows to the head, or sports-related injuries. Repetitive microtraumas such as bad sleeping habits, poor posture, incorrect lifting and carrying can also cause misalignment. Once the atlas is moved out of its orthogonal position, the body tries to compensate to maintain its center of gravity. It does this by keeping the head directly over the center of the feet. However, to maintain the level position of the head, the rest of the spine adapts and is thrown out of alignment. The body alters its structure in such a way that the muscles contract to cause one leg to appear shorter. In most cases, one leg is actually not shorter than the other, but is drawn short due to the body's compensation for the displaced atlas. The resulting misalignment may cause nerve pressure and inflammation, causing a disruption of the normal functioning of the nervous system. This one dysfunction may play a role in a multitude of symptoms and pain in different areas of the body. Besides directly impacting the neck, we can see other effects such as decreased curves in the neck, scoliosis, and changes in the alignment in the shoulders and pelvis. These changes in the alignment affect the structural integrity of the skeletal system. This in turn can result in a host of other symptoms and problems, especially headaches, neck, and facial pain. An atlas orthogonist treats this condition through a system of examination and diagnosis that utilizes a detailed scientific and biomechanical protocol. Precise measurements of the angle of the atlas are the basis of the treatments. An extensive evaluation of the patient condition is rendered by the doctor on the first visit. A complete and thorough history is critical in aiding the doctor in the proper diagnosis. This history includes asking a variety of questions pertaining to every aspect of the patient's symptoms and injuries. The exam also includes orthopedic and neurologic and postural assessment of imbalances in the spine that would lead to problems with the health of the spine and its related symptoms and pain. The first step of the diagnosis is to determine the degree in which the atlas is misaligned. Very precise x-rays are taken which show the doctor exactly how the atlas is displaced. The x-rays taken are invaluable in making the most precise atlas correction, which is as unique to the patient as their own fingerprint. Following the diagnosis, a specific treatment protocol is developed to align the atlas into the correct neutral or orthogonal position. One of the most important post-adjustment steps are post-x-rays, which are taken immediately after the initial treatments. There is no guesswork in this program. These three-dimensional x-rays are taken and analyzed to verify that the best possible correction was rendered. The doctor may then show the patient the comparison between before and after x-rays. Post-x-rays are an illustration of the exact change that has taken place because of the atlas orthogonal correction. In order to treat this condition, Dr. Roy Sweat, the founder of the Atlas orthogonal procedure, devised a method using a percussion wave, which is a vibration to reposition the atlas vertebra. Dr. Sweat is considered by many to be one of the foremost authorities in the world on the cervical spine. The history of treating the atlas goes back to the early 1900s, when Dr. B.J. Palmer, the developer of chiropractic, spent many years of clinical research in discovering that it was the atlas that controlled the position of the head and the resulting position of the rest of the spine. Dr. Palmer taught to correct the atlas position using the hands with about 40 pounds of force. Dr. Sweat and Dr. John F. Grostic were taught by Dr. Palmer. In his extensive clinical research, Dr. Grostic found that much less force was actually necessary to correct the atlas into position. Dr. Sweat, in his further research, discovered that even less force was actually needed. Dr. Sweat invented and engineered a highly advanced instrument that, without pain or pressure, is able to accurately reposition the atlas vertebra. The procedure is non-invasive and gentle. The results are often immediate and dramatic. However, the atlas may have been out of alignment for some time before symptoms actually appear. Without proper treatment, the symptoms only get worse, and the problem becomes more difficult to correct. The longer the existing condition is without treatment, the more time and treatment it may take to heal.